This would be the transport part of the video. Before any movement of the patient happens, we turn to the patient and just verify their full name, date of birth, and then the procedure that will be happening, the reason that they're here. So, if you're the patient, what is your full name?
My name is Ray.
I have
And what is your
so I don't get it all the time.
9/4/1997.
perfect? And then why are you here today?
I'm here for surgical menoplasty.
Okay, perfect. She is our patient. We verified that, and then
And now, before we move, we're going to make sure that all of the safety measures are in place to ensure the patient's safety. So we have a straight safety strap across her mid-thigh to prevent her from falling out. We also have both of our bed rails up to prevent her from falling. And then there will be 3 people moving her in and out of the OR to ensure that everything moves smoothly. We have brakes down here. And then we want to make sure that the bed is in steering position so that we're best able to get her into the OR without bumping anything.
Anything else?
the full set.
Did you do anything fun this weekend? Oh, fun.
Spin. Do you want to raise the boat?
This is the transporting group. In this case, the patient has already been intubated and so is under anesthesia. What we're gonna do right now is gonna put down the rails, take off the pillow, and then we're gonna position him and log roll him to the side. And once we're gonna do that, we can flip him over, and then one of our team members will reach over and grab him and pull him to the side correctly. If there's any readjustments, since I'm at the head, we will count to 3 and readjust him and strap him in. Start. Let's put these guard rails down. Alright. Pillow. Let's take off the straps. So on the count of 3, we're gonna roll him to the side. Right? Ready? Alright, let's try it. Okay. On the count of 3, ready? 1, 2, 3. You got him? Alright, we're long slowly. In this, now that the patient has been flipped over, we're gonna strap him in first, so that he doesn't. And then we can, and then one person can hold the stretcher. Right, strap him in. So more on the side. Alright. So right now, I will need you to stay here so that his arm doesn't fall. I will get a donut for his face. Thank you. Alright, and we can actually use
The drop sheet.
the draw sheet to like put his arms in so that his arms doesn't go. Alright, and now we're gonna start patting from the ankles. Patting from the ankles, and then we're gonna also gonna pat his. We're gonna pat also from his axillary.
So you can just, as long as we've got two people here, you don't want to hyperflex your knees. Pull up. I think I just hyperflexed it like that. And then that'll go on his ankles to avoid soft tissue injury.
Let's put an axillary roll on both sides. Can I get the next one?
And the axillary rolls are used to avoid respiratory issues, compression. Yeah, also in this procedure, since this is a Ken doll, it doesn't have any genitalia, can't accurately demonstrate it, but for this procedure, you would move it out of the way as to avoid compression, because if it is compressed for too long, it can become necrotic, and that is less than ideal.
All right, and our patient's now fully strapped in. He's in position. All soft tissue parts are properly padded, and for the face also, with all the tubes are moved from the side, and then now the surgeon and their assistant can start working on prepping the area of the operation.
Okay, so to do skin prep, you're gonna go ahead and open glove. So you're gonna touch only the outside portion or the inside portion of the glove. So that's right here. Put your hand in. And then for this one, it doesn't quite matter because everything is still sterile at this point. You just want to make sure that you're not touching anything that is unsterile once it becomes unsterile. So you can just put second hand in like this. Yes. And then if I want to pull this one down, stick my finger in under where nothing has touched my skin yet. Go like that. For this purpose, we don't have any actual skin prep, so I'm gonna use a sponge that we used for hand scrub. So not quite the same, but you grab the bottom of that package. Thank you. So for this one, this would be some sort of betadine solution. You'd want to put towels underneath the patient just to make sure that nothing is pooling on either side of the neck, just because if it pools and then evaporates, it's going to cause chemical burns on the patient. So for a scrub, you want to start at the incision and then work in circles on your way out. So the incision is going to be about here. So I'm just going to, ooh, that is an awful noise. Scrub up and then start scrubbing
around, and then once you get the full neck, you're gonna start back on the shoulder where you left off. Good. And you don't ever wanna go from clean to dirty or dirty to clean, just because that will cause contamination on the patient. So once you've done that, you do that and then do it again. And then I think that's all. And then you're ready to start drinking.
So we will now start draping the patient. I have folded the towels in the proper way so we'll be able to place them on the patient. And I will be holding them as such. That way I will be able to pass off the towels to my partner. Okay. Mhm. And we gotta make sure we cover our hands. As such. And we will also use 4 towel clips to clip around the towels to make sure they don't slide off the patient. There we go, here, here, well actually 3, and here, and make sure that we pull it up and away from the patient's skin. Oh, and I will also be in sterile attire. I will have my sterile gown, my sterile gloves, and of course the rest of my PPE. Okay, I'm gonna get the draping. This is a minor procedure draping. You also can use a split draping. So we're gonna place the drape right above where the incision will be, which will be toward the back of the, what is this? The back of
cervical spine.
The cervical spine, thank you. All right, I'm gonna pass this side to my partner and we will start unfolding. Thank you, Stephanie. And let it drop. We're gonna place our hand here and we're gonna make sure we drape our hand. And we're gonna go down with the drape. Let it drop. I will place my hand here. I'm gonna drape, thank you circulator. And we're gonna go toward the head and drop.
Lovely job, ladies.
We're gonna remove, and now you have your surgical site.